Bloomberg Audio Studios. Podcasts, radio, news.
As the world continues to respond to new contagious forms of Mpox, many people are asking, could we have done more to prevent this global health emergency?
The world should sit back and say, have we learned anything from COVID? The African region acquired COVID vaccines very late, months later. And that meant that in many cases, the people had already had the infection and people then weren't very interested in having the vaccine. Now we look at Mpox and we have the same problem.
And a much-needed vaccination program could be delayed for children under 15 years old, who account for more than 80% of the deaths in the Congo, the country worst affected by the outbreak.
To ramp up really takes a shift in resources and capabilities. We're looking at doing that. We can do that. That's how we will be able to deliver the 2 million doses. But really, we really need orders before we can move.
On this episode of the Next Africa podcast, we'll look at the response to Mpox and if it's really possible to vaccinate a country the size of the DRC. I'm Jennifer Zabasajja, and this is the Next Africa podcast, bringing you one story each week from the continent, driving the future of global growth with the context only Bloomberg can provide. Janice Kew, Bloomberg's health reporter, has been following the outbreak closely and is back on the podcast with us to walk us through the latest. Janice, great to have you back on. I know it's been a busy past few weeks. How are you doing?
Good, thank you. Yes, it has been just a lot of developments on the Mpox front.
Yeah, which is part of the reason why we wanted to get you back on. So, Janice, the last time we had you on the podcast, we were talking about Mpox being declared a global health emergency. And since then, we've seen cases now popping up in Europe, in the Middle East. And you and your team put together a really fascinating story about how this could have potentially been prevented, the spread to this extent. How could this have been prevented, considering how fast this is moving?
Jen, for decades, Mpox was just another neglected tropical disease in Africa. And now it's become a global health emergency, and arguably it's a public health crisis, as you say, that should never have been. The illness has claimed more than 622 lives and counting. Those are mostly in the Congo, which is the epicenter of the current crisis. And many thousands of others have been infected. Scientists and public health officials, as you say, have looked at how it could have been avoided, and instead, we've seen it snowball with missteps, red tape, inaction, all of these creating the perfect environment for the virus to mutate into a fast-spreading variant. It's now been detected in at least 10 countries, 2 of those outside of Africa. Some scientists have said really it's not a case of finger-pointing per se. It's probably more an example of a neglected tropical disease in Africa. These are not diseases that typically get a lot of funding and a lot of research, but they're also not diseases that are likely to make a lot of money for vaccine makers or other therapeutic companies. We saw with COVID how no part of the globe is isolated. And I think that Africa, and certainly through the Africa CDC, they are highlighting that fact and trying to, and possibly finally getting the attention that they probably should have had long ago for how these types of pathogens can spread and cause a global problem.
Considering a lot of the missteps and the inaction that you were just highlighting there, how are public health officials tackling this? Is the vaccine the way to move forward and the way to eradicate this from spreading any further?
There are a lot of plans afoot at the moment. In fact, I would go so far as to say people are scrambling to make sure that they're dealing with it as quickly as possible. That's not to say it's happening as fast as the Africa CDC initially signaled or wanted. Certainly on the vaccine front, they are now saying that they have set a deadline for September the 1st for vaccines to arrive in the Congo. It's certainly not the only measure that can be taken and is being taken. There's been a lot of conversation around getting funds to ensure that there is good public health messaging on the ground. They need to make sure that parents know to bring their children in if they're seeing any symptoms. With children, quite often it's mistaken by parents or caregivers as chickenpox, and that is causing delays in getting treatments. Africa CDC yesterday was also highlighting how teachers are being targeted in terms of public health messaging to ensure that they know what to look out for. The same is true in health facilities. There's a risk that you've got someone coming in presenting with Mpox symptoms, but before they've run any tests, they put it into an open ward where there may be somebody else battling a different disease. The vaccines are something that will help certainly in terms of containing spread. And arguably, had vaccines been in Africa when the last global emergency for Mpox ended in May of 2023, we wouldn't be in the situation now.
So where are the vaccines then coming from, Janice? And of course, the million-dollar question is, are there going to be enough to actually stop this from continuing to spread in some of these places that are just so highly populated across the continent?
The vaccines are produced at the moment by two companies that are from two different parts of the world. So Bavarian Nordic is a Danish company in Europe, and they are the main commercial vaccine. There is a Japanese company called Biologics that also produces vaccine, and there are talks underway between the agencies like Africa CDC and WHO, together with Gavi, the Vaccine Alliance, with the government of Japan. That vaccine is going to be important because it has been used in children before. Bavarian Nordic, the Danish company, they have vaccine already in stock. Bavarian Nordic has said that the 10 million doses that Africa CDC has said they need, that they can actually supply all of that by the end of next year. So they are certainly probably the first and foremost piece of the puzzle in terms of vaccines.
And Janice, stick with us because we want to talk more about the impact on children, especially who, based on our reporting, accounts for most of the deaths, and how potentially children may miss out on the vaccine. So stick with us, and we'll talk with you after the break. Welcome back. Today, we're looking at how African nations are responding to the Mpox outbreak, causing concern across the world. Janice Kew is here. Janice, we talked about vaccines, but the draft vaccine plans haven't specifically mentioned how shots will be rolled out for children. You touched on this briefly, but why not? Why haven't we seen this, especially considering the statistics at this point in time?
I think the fact that Bavarian Nordic hasn't been specifically listed for use in children may have contributed to that. I don't think the fact that children haven't been specifically mentioned means that they will not get vaccine. I do think, though, that there is a likelihood that there will be a delay, hopefully not a long one, but a delay in getting vaccine into children. This is largely because the discussions with the Japanese company Biologics are still underway. And my understanding at this point is that is the vaccine that they would likely use in children. It has been used in children in Asia before.
Is there concern that is the approach at this point in time, Janice? I mean, that adults are going to be the first ones vaccinated?
Children account for more than 80% of the Mpox deaths in the Congo. And so them not being first in line is a concern. The pediatric vaccine plan is not clear at this stage. And I would imagine that aid organizations and doctors and people on the ground are not at all happy with the fact that there isn't a clear and specific plan for children to be getting this vaccine quickly. It is a complicated and tricky situation. Getting vaccines rolled out is as important as getting vaccines on the ground. We saw with COVID that Africa was last in line to get vaccines. And when they eventually arrived, there was logistical problems with the rollout. And there was also a lot of hesitancy with people questioning whether they actually needed the vaccine. The Africa CDC and Helen Rees, who's advising, she's part of an advisory committee for the World Health Organization, she spoke to Bloomberg TV recently and was saying that she does not think that there will be a problem with hesitancy this time around, that this is a disease that has caused a lot of problems in various communities and specifically in the Congo region. And so people will probably accept the vaccine quite readily, which is good news. I do hope that is the case. But that doesn't take away from the fact that there are these other logistical issues in getting the vaccines rolled out and in ensuring that they are safe to be given to children.
So in a sense, is the overall feeling that authorities are still sort of on the back foot in getting a hold of what's happening right now? Or are people confident that we're not doing a repeat of what we saw during COVID and other outbreaks?
I think there is growing confidence that it is not going to be a repeat of COVID. The World Health Organization set out a prevention and preparedness plan this week, and that is an effort to really coordinate all these efforts. I think when there is an outbreak and there is an emergency, and it's easy to panic, and it's easy for governments individually to reach out to the vaccine makers and for everyone to want to make sure that they are being taken care of, or at least are taking care of their people. The WHO has always provided a sort of coordination effort, and the Africa CDC has moved in very strongly this time round and made sure that they're in the driving seat, that they're marshalling resources. And there is a lot of evidence that is happening. Globally, we've seen responses from the United States and many others saying that they are prepared to donate funds and, in some cases, vaccines themselves, because some of these countries had stockpiles of Mpox vaccine from the 2022-2023 outbreak. So I don't think we're going to see a repeat of COVID. That being said, there are still bottlenecks, and there is a lot that scientists do not yet know about the specific clade 1b, which appears to be fueling this outbreak. And they are still scrambling to get enough information. Unfortunately, we may not have been in a situation of a mutated strain if Africa had these vaccines some years ago. It is a difficult situation, but one that I do think all the agencies are responding to as best they can. It does feel to me a little bit like it was a situation of wait, and then hurry up, and now a little bit more wait because they're trying to get all the pieces of the puzzle together. But I do think that there is motivation and focus to get that job done now.
Well, we know as those pieces continue to come together, you will be all over the story, but we appreciate you coming back onto the podcast and giving us an update. Janice Kew, thanks so much for your reporting. And you can read all the latest coverage on the outbreak on Bloomberg News platforms. As Janice said, this is still an evolving situation. And even as vaccinations commence in the DRC, there are still more questions than answers about the mutated strain. Fortunately, though, officials do seem committed to avoiding some of the mistakes made for the continent during the COVID-19 pandemic. This program was produced by Adrian Bradley. Don't forget to follow and review the show wherever you usually get your podcasts. I'm Jennifer Zabasajja. Thanks as always for listening.